So those 3 words I asked you earlier, what were they?
Car, pencil, dog.
Wonderful. Okay, so here's the internal structure of the ear. We're looking at the membrane, most of the canal, make sure that it all looks good. I'm going to repeat that on the other side.
Not holding.
Oh,
Let's
he turned up the other.
I wasn't gonna jerk away, but. You gonna nail us on that one?
And now for those of you that are following along with this, you'll see that I did skip the eyes initially and went to the ears. So if I'm going to go back in order again, I can still go back and fix that and correct that. So we're going to go back and check eyes now. So I want you to close your eyes really tight for me. Wonderful. And open them back up. Great. Okay, I want you to follow my finger with your eyes. Wonderful. Now checking cranial nerves 3, 4, and 6. I'm going to go do a vision screening. So basically I want you to just put this at about arm's length and then tell me which line you can read.
Clean my contacts. 937-826.
Okay.
That's that little one.
Wonderful. Just going to check your pupils now to make sure that they dilate as they're supposed to. So bright light in the eye. And again. Okay. And normally for this part of the exam, I would go ahead and dim the lights so that it opened your pupil up so that it'd be able to see better. However, for the video, we're not going to do that. So we're just going to basically simulate how we would do this properly. Make sure that this is honed in how I want it. Okay. I want you to focus on, say, the fire alarm that's up there. I just want you to keep looking at that. Good red reflex. You should be able to see through the pupil into the back of the eye, checking the retinal disc, checking for any hemorrhages, things of that nature. So we didn't do the hearing test, so we're going to go back to that now that we cut back up on the eyes. So I'm going to stand behind you. I'm going to whisper something. I want you to plug your left ear. Okay.
42.
Wonderful. Now plug your other ear.
13.
Wonderful. Okay. Now do the Weber and Rana test, which are not normally done in a full health head-to-toe assessment. Does it lateralize to either side? As far as can you hear one?
Yes.
Wonderful. Okay.
That's the Weber, right?
Yes. So now for the Rana, what we'll do, I'll go back here so you can see.
This is the read.
I'll put it back here and tell me when you can't hear it any longer, and I'm going to count.
There.
Tell me when you can hear it again.
There.
Okay. So hopefully we're getting about a 2-to-1 ratio, which is about what we got, so that's wonderful. And then we would repeat that on the other ear if we needed to. So now we'll go on to the nose. Going to externally look at the nose, make sure that it looks appropriate. I don't see anything that looks concerning. Okay, I want you to just look straight up for me. I'm going to lift the nose slightly and inspect internally, make sure that everything looks okay. Don't see anything that's concerning.
You get a picture of my nostril?
Yes.
Now, I want you to go ahead and close your eyes for me.
No, 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 no.
I want you to plug one nostril. Can you breathe out of the other side? Some people with allergies right now can't.
I can, yes. I don't have allergies.
Okay. Okay, tell me what you smell.
Vanilla.
Okay. Go ahead ahead and keep your eyes closed. Plug your other nostril. And tell me what you smell again.
Spearmint.
Okay. You can go ahead and open your eyes, unplug your nose. That was testing cranial nerve 1. So move on to the lips. Looking at color, symmetry, any lesions. I don't see anything that looks bad at all. So wonderful. Then at this point, we're going to go ahead and check her teeth, her gums, and her buccal mucosa. I'm not going to palpate for purposes of the video, but go ahead and open your mouth for me. Great, I don't see anything that looks concerning. Tongue looks good. Now again, at this point, if I had gloves on, I would go ahead and palpate all around the mouth to make sure that there was no open lesions. So go ahead and stick out your tongue for me. And move it to the left and to the right. Okay, and then one more time, stick it out and say, ah, real big. I want to make sure that the uvula moves up like it's supposed to, which it does beautifully. So we're going to check TMJ movement. TMJ is going to be right here on the side of your face. Go ahead and clench your teeth down for me. Once you clench your teeth down, you can relax. You'll feel it right there, any tenderness. Okay. While I'm here, I'm going to go ahead and check the temporal arteries, make sure they feel good. Good. Also, there's no concerns there. We've already checked cranial nerve 5, so let's get past that for those of you that are following along on the paper. So now we're going to move to the lungs and the thorax. So I'm going to go around behind. And at this point, if this wasn't a student video, I would have her just rub her back so that I could see symmetrically. So go ahead and lean up for me. Okay, so I'm going to check symmetry. I want you to exhale. Take a big deep breath. And then exhale again. Wonderful. So you can see that my hands were a symmetric expansion, and then once you exhale, you come back together perfectly. So that's just how they should be. I'm going to go ahead and check tactile firmitus now. So I want you to go ahead and say 99.
99.
And just keep saying that.
99. 99. 99. 99. 99.
And that's about where it stops. So we're going to plan that that should be about the same place that it's going to stop on the other side. Just go ahead and repeat that.
99. 99. 99. 99. 99. 99. 99.
Great. Okay. Take a couple deep breaths for me. You just breathe normal. So when you're auscultating the lungs, you want to make sure that you do it on the same area on both sides. And some of the books will say you need to do at least 8 points. Others I've seen have said as many as 14. The main thing that I'm concerned about is make sure that you're doing it on the same on both sides so that you can compare lung fields. Go ahead and check your CVA tenderness. Go ahead and lean up for me one more time. And notice whenever I'm doing this, I'm not actually hitting the patient. I'm hitting my hand. Any tenderness? Okay. Any tenderness?
Yep.
Wonderful. You can sit back up. Okay. I'm going to skip the breast exam at this point. So we're going to go to the heart. And it's good to explain to your patients that you're going to auscultate the heart in several different places. That way they don't think that there's something to be concerned about when you're listening to it for an extended period of time. The other thing that I did forget that I want to go back and do also, just that's in the paper, is checking your thyroid, because that is one thing that I didn't do earlier. So go ahead and check your thyroid.
That's great.
Hold on, it's freezing. But the timer's still going.
That's odd.
I have to do this in 2 sessions.
Yep.
I figure I'll just splice it together.
Can you change your toenail
Is it
color
gonna be on
depending on
there
what you're
tonight?
wearing?
No.
I hope so.
I noticed that too.
I was just making sure. 'Cause you